Hello, this is Dr. Charif.Sidani. I'm a neuroradiologist. This is the first lecture in my neuroradiology imaging series, basic lecture about head CT. This basic lecture is intended for medical students, radiology technologists, first year radiology residents, nurses, and physician assistants. It's a presentation intended for educational purposes only, so keep that in mind. So this is a two-part lecture. And in the first part, we are going to go on how normal structures appear on a CT scan of the brain, what calibration and windowing mean, and how that affects the way the image appears, how basic pathology appears on CT and why, and we'll cover some of the advantages and disadvantages of CT. The second part, which is intended more towards radiology residents, goes over a systemic approach interpreting a CT scan of the brain. So let's start with part one, how do normal structures appear on CT scan of the brain and why. Just as a quick reminder, the electromagnetic spectrum is made up of different waveforms of different energy. The ones that are used in radiation, X-rays and gamma rays are among the waveforms with the highest end of that spectrum in terms of energy. So a simplified way to understand how radiation works and how an image is generated is the radiation wave, in this case we're talking about X-rays, pass through a patient and then are captured by a detector. Depending on the magnitude of that wave that's captured by the detector, an image is generated with different colors. This is one of the most important slides, and if you understand it, you can understand how imaging or how structures are displayed on an image, whether it's a neuroradiology study, a chest X-ray, a hand plain film, etc. It can also help you identify how pathology looks. So as the waves enter into a patient or structures within the patient are usually of a very similar magnitude. If it passes through a structure like the air and the sinuses, which provides very little density and very little hindrance to the waveform exits with very similar characteristics. A very strong waveform usually is captured by the detector and translates on the image as a shade of black. The denser the structure, like water in the ventricles, in our case for neuroradiology, there is slight attenuation to the radiation that's exiting, and now the detector captures that image and translates it into a lighter shade of black or a shade of gray. As structures become denser, in this particular case gray matter and white matter in the brain, there is more attenuation to the waveform, and now that's translated into a lighter shade of gray. With calcifications, as you can expect, there is significant attenuation of the waveform, and now that projects as a shade of white. And if we have radiopaque foreign bodies like metal, that significantly attenuates the waveform, and that translates as a very bright object. Now these are not individual colors, this is a spectrum of colors depending on the density. Even slight alterations in the density of a structure, whether it's from normal appearance or from pathology, results in change in the way it displays. So let's give some examples. On this chest X-ray, we see the different colors reflecting the different physical densities. Air has a very low density and projects as black. Fat, whether in the subcutaneous soft tissues or deep fat planes, projects as gray. As the density of structures increases, like the muscles, we have different shades of gray. Along the higher end of the spectrum, higher density within bone projects as white, and radiopaque structures such as the spacer and its wires, the orthopedic hardware, or even the markers used by the technologist project as white. MSK structures, plain film of the hand, we have the soft tissues as different shades of gray. We have bone that is along the shades of white, and we can even see that within the osseous structure itself, the medullary cavity is less bright or less dense than the cortex, which has more compact cells and more density. And we can see that when structures overlap each other, they provide a combined higher density and a shade or a color that is more white. Going to neuroradiology imaging, we see the gas within the trachea. We see that the fat and the subcutaneous soft tissues are gray, lighter gray when muscles are involved, cartilage, osseous structures become whiter and the cortex is always whiter or more dense, and then foreign bodies are very dense. And finally, and last example on the plain film is that gas within the paranasal sinuses is dark, soft tissue is gray, osseous structures are white or dense, and we can see that the cortex is denser than the medullary cavity, and in this case we have dental fillings which are very dense or very bright. The same principle applies to CT. So if we go through these two images, gas within the paranasal sinuses and within the mastoid air cells is black. Water within the, or CSF, within the ventricular system is black, but to a lesser extent. We have gray matter and white matter provides shades of gray, with the white matter darker than the gray matter. The gray matter is denser, more compact. And finally, the osseous structures are very white. Now, if you viewed images before, you can realize that CT is reliable, and every time we get a CT, the image and the appearance of the structures is identical from time to time. And this is because of a process called calibration. The CT is calibrated such as a physical density corresponds to a CT density, which is called the Hounsfield unit. And in turn, that corresponds to a color density, if you want. So usually the calibration is set such that physical density of 1.0, which is water, corresponds to a CT density of 0. And when that is kept in mind, fat, which has lesser density, and gas are along that spectrum. Gas will always project as almost a minus 1000 Hounsfield units and will be black. Fat will be in the range of minus 10 to minus 100 and will be along shades of gray. Water, iron, for example, in acute hemorrhage, calcium, and metal. So what does that mean? Because of calibration, every time we measure pure CSF, we're going to get a density which is almost 0. Every time we measure gas within a structure, whether that's in the paranasal sinuses, whether that's in mastoid air cells, whether it's in the lungs, it's always going to have a density of minus 1000. Another process that CT uses is called windowing. And that means that just like you can change the filter on a digital image on your phone, you can change the appearance of structures relative to each other to see them better. Now I was seeing the brain parenchyma better. I changed the window. Now I can see the soft tissues and the fat planes in particular better in the orbit, subcutaneous fat planes. And if I change the window and the reconstruction algorithm, I can now see osseous structures to a significantly better extent and the paranasal sinuses to a better extent. Again, just like changing the filter on a digital image on your phone, when you change the window, the image appears different, but its intrinsic properties are always the same. So in this case, I don't see the fat planes very well. I see the parenchyma very well. In this one, I see the fat planes very well. In this particular window, I only see the osseous structures well, but I lose visualization of the brain parenchyma and the fat planes, subcutaneous fat planes. The intrinsic properties of every structure is exactly the same. So if I measure the fat, it's always going to give me a density of minus 100 units, regardless of what image I'm measuring on. Again, even if a structure is not visible on one window, for example, in this case, the ventricular system, in this window, I see the brain parenchyma very well, I see the ventricular system very well. In this image, I only see the osseous structures very well, but every pixel of this image will maintain its intrinsic properties. Another advantage of CT is that we scan the patient once and we can perform these multiplanar reconstructions. In addition to changing the window, now I want to see the midline structures, the sella, the pituitary gland. Sagittal image provides an excellent visualization. I want to see the orbits and follow the optic chiasm. The temporomandibular joints, the coronal plane provides adequate visualization. The advantage is we're scanning the patient once, but we're reconstructing in different planes only from one scan. And that can be taken a step further, in which we can do 3D reconstructions. For example, you want to visualize all these fractures preoperatively, postoperatively. Can see that CT provides this reconstruction very well. So how does pathology look on CT? using that exact same principle that the appearance of the structure or the color of the structure, the density in proper medical terms, is a reflection of its physical density. Similar to how normal structures appear, we can predict the appearance of abnormal structures. So now if we have pathology that has air density like pneumocephalus, we expect it to be black. Pathology that has water like edema, whether this is an infarct, demyelinating disease, an infection, or edema associated with tumors, it's going to be along the shades of gray. Acute hemorrhage, it's going to be brighter. And metallic structures, whether foreign bodies or hardware that like orthopedic hardware, it's going to be white. Let's give some examples. So pneumocephalus, this can be a normal post-operative appearance or can be caused by trauma. The density is going to be similar to that of gas, and the color is going to be black. Going to pathology with a higher density like edema, whether it's edema associated with acute hemorrhage, edema associated with an infarct, or edema associated with demyelinating changes, in this particular case chronic ischemic changes, it's always going to have a very similar density and similar appearance. Of course, to make the diagnosis, we have to rely on additional findings, including the shape of the abnormality, etc. Going to higher density pathology, acute hemorrhage, whether it's intraparenchymal, intraventricular, or subarachnoid, that's going to shift the appearance of the density higher, and things will appear brighter. Enhancement of normal structures or of tumors, again, that has a wider range and will be covered in a separate lecture, but since this is dense, it will appear as, in general, as white. Calcifications, whether it's a calcified tumor, like in this case a meningioma, or a normal calcified structure like a choroid plexus, again, you can see that those densities overlap and there's always a range. So going back, you can see that there's overlap between enhancing structures, calcifications, and finally, metallic structures, in this case vascular coils, are going to be along the highest spectrum of density and color. Finally, what are some of the advantages and disadvantages of CT? Advantages include that this modality is readily available, it's very fast to perform, there are virtually no contraindications, and this combination makes it excellent in the emergency room setting, in the setting of trauma, and in the setting of stroke. Like every modality and everything in medicine, CT has disadvantages, and some of those include the fact that it utilizes radiation and the low sensitivity to detect and characterize parenchymal pathology. Just as a brief overview, this will be described in other lectures, but we saw that edema associated with infarcts, edema associated with old infarcts, and edema associated with acute hemorrhage all look the same. So other modalities may help characterize this better. We're particularly talking about MRI. So advantages of MRI include the fact that it uses no radiation and that it has high sensitivity to detect and characterize parenchymal pathology. MRI, on the other hand, is not readily available. It has several contraindications and is a very long exam. So basically, CT and MR advantages and disadvantages are opposite to each other. These modalities are complementary. So in summary, plain radiographs and CT utilize radiation. The appearance of normal structures and pathology can easily be predicted. To do that, keep this slide in mind, that the way the radiation is attenuated by the density of a structure, whether it's a normal structure or whether it's pathology, is going to determine its color, which in the medical terminology we're going to call its density on CT, and this applies for normal structures and pathologic structures. Keep in mind the calibration and windowing of CT allows us to view the image in different ways, each one demonstrating a structure to a better extent. In this case, for example, the brain parenchyma. In this other end of the spectrum, it's the osseous structures, but this does not change the intrinsic properties and the CT density of every structure that we're viewing. Keep in mind the advantages of CT. It's a readily available modality, basically has no contraindications, and it's excellent in the emergency room setting. Some of the disadvantages include radiation and low sensitivity to detect and characterize pathology. If you want to keep learning more about neuroradiology, subscribe and check additional videos, and check additional posts which will contain links to self-assessment modules.